Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
Ooh, in our opinion, of course, Bob.
Remember that was Arsenio Hall used to do that woo, 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 woo. You don't
I remember the name, but what did, well, let's get on with this
program. He was
program.
a talk show host that night, Bob. Okay, today we're going to talk about 10 exercises to instantly improve your knee pain. We've got range of motion exercises, we got strengthening exercises, we got stretching exercises, and we actually got one posture, believe it or not, for your knee. You got to have good posture in your knee too, Brad.
Right. Well, people are going to be waiting for that one.
All right. If you are new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free. We upload every day. Also, we beg of you, go to Facebook and like us. We're getting more likes every day. Bob and Brad, you like us, we like you. It's a reciprocal thing.
There you go. It's a win-win situation.
Yeah, I love win-win. All right. So the first thing you want to do when you're having knee pain, especially if you're a little bit older, you want to make sure your knee has full motion,
right,
as compared to the other one. So that means full flexion. So if I'm checking out, how much my knee bends. If I'm having pain in this knee, I want to see, does it bend as much as this one does? And you can tell. I mean, you can feel like, when you bring it up like this, like, yeah, this one goes way back easy.
Right.
But this one, it just feels like it's kind of blocked a little bit.
Yep.
If that's the case, you're going to want to work on flexion, which I'll show you in a second. The other one you want to do is go ahead and you're going to put your legs up on probably more of a chair or a stool.
Sure.
And you're going to compare the two, and you want to see, Brad, if you're on your side, there we go.
So, yeah, we're talking about this, will the knee straighten all the way or will it not? So if this one's straight and this one only goes down that far, and there's oftentimes some pain associated with that, we want to somehow get this knee to get to where it used to be, so they look the same.
Yeah, we've seen this many times in our practice where if you regain just even a few degrees of motion, a lot of times that knocks pain levels down.
Sure.
Without a doubt. So, all right, let's first show knee flexion. And this is one we have a lot of people do. It's the mulligan technique. So you're going to put your foot up on a stool or up on a chair.
Right.
And you're going to go ahead, and I'm doing a stool because I'm a tall guy, so I can get away with it. And you can just work on knee flexion first without doing anything. Just a little bit of pressure on, pressure off. But if you want to add a little bit of manual therapy, as we call it, you're going to grab the lower bone here, and you're going to turn it towards the other leg. So I'm turning it this way. So if it's your right leg, you'd be going counterclockwise.
Sure.
So I'm grabbing it, I'm turning it counterclockwise, I'm holding it in that position while I bend. And I straighten. I'm still holding it in that position the entire time.
And you may want to point your toes in that direction to help get that rotation. So when Bob says you're going to grab the bone, he doesn't really mean you're going to grab the bone, but you got to grab the leg, essentially grabbing the bone. That could throw some
grabbing
people
the skin, I guess, around the bone and then fat.
But as far as therapists, we're thinking we're going to internally rotate the tibia. So go ahead, Bob.
So let's go to the other side. And now with this one, we're actually going to turn the bone or the leg clockwise. So I'm turning it clockwise and I'm bending the knee. I've just had some people that even when they have like a little of a meniscus problem or a cartilage problem, sometimes this kind of helps get back in place.
Right.
So.
And, Brian Mulligan, the therapist who supposedly originated this, he goes through in detail, if you go to his class, why this works and whatnot. So
exactly,
it should, it should feel better, and you should get more range of motion. If it creates some pain, then you're going to stop. It's not the right exercise. Then you're going to go on to one of the next ones.
This is a simple one to do. You can actually try another way to increase knee flexion. You just put a towel underneath your knee like this. And you grab onto it like this, and it kind of gaps the knee a little bit.
Right.
You get to make sure the towel's fairly thick, and you're going to pull it like this. You want to show it, Brad?
Yeah, from a profile. So you get it right up in the crux of the knee there, and then it's going to get in the way, create a little interference, but that actually, like Bob says, it pulls the joint apart slightly, which can be very beneficial. And again, when you do that, you should feel like, oh, that's a good stretch, especially after some repetition. It should feel better and better. So that's a nice, simple one.
Okay, another one. Let's say you are lacking some of the straightening. I'll take that stool again, Brad,
absolutely.
since that seemed to work for you. So you're going to just go ahead and you're going to put your leg, the one that's tight, that's not straightening all the way, I'm going to put it up on a chair. And, you can push above the knee and below the knee. pressure on, pressure off, or you can just push above the knee
Sure.
sometimes.
Usually want to stay away
on,
from the kneecap.
Pressure off, pressure on, pressure off. We say the words because that tells you how long you do it. You know, that kind of gives you a cue on how long you do it. And you can do this like 10 times. Don't get too aggressive the first day. I always tell the story about the gentleman, older gentleman who was in his 90s, I think, when I had him do this. And he went gung-ho the first day and came back and just was so mad at me he wasn't going to come back again. By the way, he did come back, and eventually he did get better doing this.
But he backed off.
We backed off.
Sure.
Yeah. So eventually you could do it every hour.
Right.
But the first day, just maybe do it 10 times, see how it is. Maybe next day do it 2 times, 2
Right.
sets, and work your way up.
Yeah,
there.
you kind of have to get the rest out, so to speak.
So that in essence is the range of motion you want to do. But now you're going to want to stretch the muscles around the knee too. If the muscles around the knee are tight, they're going to throw the knee off. It's going to have increased forces on it, and the forces may be unequal on it too.
Right.
So Brad's going to show a hamstring stretch, and there's a lot of different ways you can do it. You can take a sheet or he's got the stretch out strap there.
It really it works nice, but you could use, a belt or sheet, but the strap has loops that you can use, and I'm going to use that to get around here. And you could do this one standing up, not this particular one, but you could stretch his hamstring standing up, or this is nice because it's easy to
He's talking about
relax.
standing up, yeah, you can lean forward like this, keeping your back straight and just stretching your hamstring. But yeah, this is a nice one if you can kind of do your stretches all in bed here to a large extent.
And you really relax in this position, which is advantageous to let the muscles stretch out more. I'm going to hold. And this, you can do the longer hold for 15 to 30 seconds. I personally like to do the pressure on, pressure off. I don't know if we want to get into the...
Contract, relax.
Right.
So, yeah, let's keep it simple today,
Yeah.
Brad. So, all right, and how about a quadricep stretch?
This is one where the strap really is helpful.
Yeah, because it's kind of a hard stretch to do in bed, unless you have some strap or something to help you.
Right, but if you have this, it really becomes easy to do. So I'm going to lay on my stomach, put this around my foot.
And there he goes. He's stretching the quadricep.
There we go, good control. And I'm going to stick my hand in there and don't even have to hardly grab. Stretch.
Now you can do it this way too as you start to gain some flexibility. I just, I can grab the pant leg first and then eventually grab the ankle. I usually grab it on the opposite side. This is how I stretch mine in the morning. I just grab them.
You do yours on the opposite side, huh?
Yeah.
Okay.
You do yours the same?
Yeah, I usually use right hand, but...
See, that's hard for me. I can do it, but it's not as comfortable.
Right.
to do it.
So you experiment, see what works best for you.
My wife, while she's getting her coffee ready in the morning, she goes up to a cabinet and puts her foot up like this.
Oh, really?
And puts it onto like a drawer and then leans back against it and stretches that knee.
That's a good idea for a kitchen option. You could have the stretching cabinet.
There we go. That's another one of our inventions that's going to be coming out soon near you. All right, why don't you show an IT band stretch, Brad, if you could.
Sure. So sitting down.
The IT band crosses the knees, so you want to make sure you're stretching that too. Here's a simple way to do it.
So the stripes actually, are very close to where your IT band is from the hip over, and you're actually stretching some of the band, but we're getting the muscle belly up in the hip as well. You might go over like this and stretch. Just pulling that knee over. If you see it from this angle, you can see I'm pulling this way, so it's a little easier to see. On this table, you're not going to do this on a table. You're going to do it on a carpeted floor is the best way to do this one.
So that's the main stretches we want you to do, that for muscles that cross the knee in some fashion. And now we're going to show a couple strengthening exercises. We had 3 that you could do. One is clamshells.
Yep.
This is to help strengthen the external rotators of the hip. And you think, why do you need to do that? Well, a lot of people have issues where the knee goes in a little bit like this, and it actually puts forces on the knee that will cause pain, especially on runners and athletes. So we really like to have you do clamshells, which is, basically he looks like a clam opening up here.
So you bend your knees kind of in that fetal position, and you do 10 to 15 of these. If you're finding this is not, it's too easy, then you can put a resistance band. Here we got the loop sank band. That works nicely. And that makes, that's going to give you plenty of resistance.
I think you'll find out to start off with, though, you don't need to, do you, though?
No.
I mean, those are harder than
I've
you
only
think.
did 4 of them, but
Yeah.
I'm feeling a burn right here already.
It's kind of a small muscle,
Yeah.
some of the smaller muscles, and so they can burn pretty easy by doing this. So now I'll show the next one, Brad. I like this one, the ball on the wall. The reason I like this is if you're having knee pain, you can actually do shallow squats. So if you only go down like this far, you're really not putting that much stress on the knee, but yet you're strengthening the knee.
Sure, right.
I mean, you can actually have cartilage problems and still probably squat down this far,
Right.
And you're not grinding that cartilage together.
Right.
So
the pain-free range.
So he's going to show that the knee is not passing the foot. So I'm not going like this.
There you go. Good.
Because that puts a lot of stress on the knee.
That's a good demonstration.
And that's what's nice about the ball. You kind of just dipping down and coming back up again. And as you get stronger, you can try to go down further and further and further.
Right.
And again, strengthen some good muscles in a functional manner so that it kind of pertains to life, when you're lifting things.
Right. Good weight bearing. Yep.
All right, then you're going to do the hamstring on the ball. So we're strengthening the hamstring now.
So again, do this on the floor, on a carpeted floor. We're just doing it here for easy filming. Hips up like this, and the higher you go with your hips, the harder it is. So to start out with, you may just lift up a little bit, pull the ball in towards your bottom side.
You could just actually do the ball without lifting the hips, right,
yep.
Brad?
This is working the hamstring. It's low intensity, but it may be what you need depending on your situation. And as if you do 10 of them, it's good there, then you're going to start pushing into the ball and squish the ball a little bit. 10, if that's easy then we're going to lift up the hips, and that becomes much more aggressive. And for the real athletic people, you may end up going to one leg, which is...
So are you considering yourself the real athletic person?
No, Bob, I just faked that.
All right.
I only did 2 of them.
And the final thing we're going to show you is real quickly is posture. You don't want to stand with your knees locked all day long. I've had patients that literally, this was causing their pain. They stand like their knees locked like this. Yep. It really grinds the knee joint together. So you want to make sure you have a slight bend on your knees, and a lot of people don't realize they're even doing it. So a lot of times it helps if you stagger your step. It's like one foot in front of the other and have a slight bend. But especially if you work on your feet, you're behind a counter or something like that, make sure you're getting that slight knee bend, and that'll help take away your pain.
I think people who are hypermobile and have hyperextension have a tendency to do that, and that can be a problem over time.
Exactly. So thanks everybody for watching.